Welcome from the specialist women's and men's health physiotherapy teams across Dorset. We hope that you will find this slide presentation helpful, and at the end we'll signpost you to other sections that might also be useful for you to watch, depending on your symptoms. We will also give you details at the end if you need to contact the physiotherapy team that asked you to watch this presentation. Pelvic floor problems affect 1 in 3 women, but only approximately 30 to 50% will seek help. Pelvic floor problems may include prolapse symptoms, bladder or bowel symptoms, as well as pain or discomfort with sexual intercourse. Reducing the strain on these pelvic floor muscles, as well as strengthening them, is important, but we know that 30 to 40% of women don't do their pelvic floor exercises correctly. With the right help, information and advice, 80% of women receiving physiotherapy will get better. So let's get started, but before we do, don't forget that approximately 1 in 10 men will also be affected by or experience bladder and bowel issues too. Pelvic floor weakness can lead to common pelvic floor problems such as prolapse of the bladder, bowel and/or uterus. You may experience bladder and/or bowel symptoms such as incontinence, urgency, frequency and constipation. The pelvic floor also has a role to play with sexual function, and if you have any problems or pain with intercourse, this is something that would be useful to discuss on an individual basis. You may have one, some or all of these symptoms, but reducing the strain on the pelvic floor muscles is key. Don't worry, we'll tell you how to get further help from our teams at the end of this section. The floor of the pelvis is made up of layers of muscle and other tissues which stretch from front to back like a hammock and support the organs of the pelvis. This is a picture of the pelvic floor in cross-section, where the pubic bone is at the front and the tailbone or coccyx is at the back. If you start at the white oval, or the pubic bone, the pelvic floor muscle runs around the opening of the bladder, continues backwards around the vaginal opening, labelled vagina on the diagram, and passes backwards to wrap around the back passage or bowel before inserting into the tailbone at the back. Your pelvic floor muscles support your bladder, womb or uterus, unless you've had a hysterectomy, and the bowel. These muscles help you to control your bladder and bowels, and they also help with sexual function or pleasure. It's therefore vital that you keep your pelvic floor muscles exercised and healthy. This slide just views the muscles of the pelvic floor from above. The pelvic floor muscles have 5 functions. One of the functions of the pelvic floor is to support the internal organs, therefore preventing prolapse. It is also part of our core stable muscle control and communicates with the lower abdominal muscles to support the lumbar spine. For example, Pilates-based exercises focus on this area. We can use the pelvic floor to delay bladder and bowel emptying and maintain storage until a convenient time, when we can relax those muscles to allow emptying of the bladder and bowel. As mentioned before, sexual function is dependent on a healthy pelvic floor. So these are 5 important reasons to keep the muscles exercised and healthy. These pictures demonstrate very nicely the relationship between the pelvic floor organs, ligaments and muscles. If you can imagine, the water is the pelvic floor muscle, and when weak, as in picture B, it offers no support to the ship, and the ligaments, which are the ropes to the side, are uncomfortably stretched and the ship descends. If the pelvic floor muscle is strong, then it acts as a float to lift the pelvic organs and reduce the strain on the ligaments. There are many factors that impact on the function of the pelvic floor. One of the major factors for women is pregnancy and childbirth. The more vaginal births experienced, the greater the risk of pelvic floor trauma. We will discuss your deliveries with you in more detail, taking into account the length of time pushing, the weight of your heaviest baby, and whether you had an episiotomy, a tear, or a forceps delivery, for example. A caesarean section will still have an impact on the pelvic floor, as from 20 weeks of pregnancy, the weight of the baby is significant enough to have an influence on the pelvic floor. As our age increases and we enter into the menopause, our tissues thin and lose elasticity. The loss of estrogen reduces the moisture or lubrication and the plumpness of these tissues and muscles. This can be a time when bladder and prolapse symptoms can become more apparent. Surgery, especially vaginal hysterectomy, can affect the ligaments and the connective tissues, and this, in combination with pelvic floor weakness, can leave it vulnerable to prolapse. If we're carrying too much weight, this has a direct impact on the pelvic floor as well as on other muscles and joints. A 5 to 10% reduction in weight can lead to a significant improvement in urinary symptoms. Smoking is an irritant for bladder urgency and also affects the estrogen receptors in our tissues, which leads to a loss of bulk and buoyancy in the muscle. Smoking can also lead to chronic chest problems with coughing, which increases the force on our pelvic floor, weakening the muscles, and can also exacerbate symptoms of urinary leakage and prolapse. High impact and strenuous exercise also has an impact on the pelvic floor, especially if you do not exercise the pelvic floor in readiness to support you during more strenuous activity. Some of our genetic makeup predisposes us to having pelvic floor dysfunction due to hypermobility, for example. And if you have a lifestyle where you're on your feet most of the day and are lifting or carrying large loads or heavy loads, then this can also put repeated strain on the muscles of the pelvic floor. Finally, constipation. This is one of the most common digestive complaints and can be one of the biggest influences on pelvic floor problems. The nature of having to strain to open your bowels stretches and weakens the muscles and the nerves of the pelvic floor. This is the Bristol stool chart, which shows a range of stool consistencies, starting from type 1 at the top, which are small dry pellets that are hard and difficult to pass, resulting in constipation, down to type 7 at the other end of the spectrum, which is mostly liquid and very difficult to control. The ideal stool consistency is somewhere between a type 3 and a type 4, which is soft but formed and easy to pass. Your stool consistency is dependent on what you eat and drink. Therefore, a healthy balanced diet with fibre or roughage and a good intake of fluid will assist in keeping your bowel movements soft and regular. So let's talk a little bit more about fibre. There are two types. One is soluble fibre, which is found in fruit and vegetables and oatmeal. It dissolves in water to form a gel-like substance which can bind to other substances in the gut and slow down digestion and the movement of food through the system. This increases the bulk of the stool and thickens the consistency. Too much soluble fibre, however, can cause loose stools. The other type of fibre is insoluble fibre, which is found in cereals, nuts, seeds, brown bread, brown rice and wholemeal pasta. This type of fibre is not digested by the body, but absorbs water very effectively, contributing to an increase in the weight of the stool. It doesn't dissolve in water, so it passes through the gut relatively intact, speeding up the passage of food and waste products. It is why it's often referred to as nature's broom. A balance of both types of fibre should be included in your diet. The recommended average is 18 to 21 grams of fibre a day, but the average person only eats about 12 grams a day. If you're increasing your fibre intake, it is important to do so gradually. A sudden increase can make you produce more wind, leaving you feeling more bloated, and it may also cause some stomach cramps. More detailed information is on our fibre leaflet, which can be found on the internet, and there is a link to this at the end of this section. The best technique for emptying the bowel is called the brace and bulge position. It helps you avoid straining by relaxing the pelvic floor muscles and generating pressure within the abdomen rather than pushing and straining down through the pelvic floor. In step 1, the picture shows a seated position with your feet supported on a footstool or an upturned washing up bowl. This elevates your knees above your hips and straightens your lower bowel, helping it to better empty. Step 2. Lean forward at your hips, resting your elbows on your knees, keeping your chest lifted and your spine straight. This forms the brace part of the brace and bulge technique. Step 3. Breathe in deeply so that your lower abdomen, or tummy, relaxes and bulges forwards. Make your waist wide by saying mmm, which increases the pressure in your bowel. Bulge your tummy forwards by saying ooh. This action relaxes and opens the ring of muscle around your back passage. The final picture shows all of this put together. You may need to practice this several times to get used to the actions, which may be different to what you're used to doing. These pictures show the anorectal angle in sitting and in squatting. The anorectal angle is the angle of the bowel created by the sling of the pelvic floor muscles as they pass downwards and backwards to loop around the bowel. In sitting, it is held at 90 to 100 degrees. When having a bowel movement, this angle needs to straighten in order to allow the stool to pass down and outwards easily. This is done by putting your feet on the footstool, which mimics squatting and improves bowel emptying. We hope that this introductory section has been helpful. If you want to know more about pelvic floor strengthening, which is important for bladder and prolapse symptoms as well as bowel weakness and incontinence, then please visit our section entitled Pelvic Floor Exercises. Otherwise, if you have more specific bladder or prolapse symptoms, then please visit those relevant sections. Further help and information may also be found at the websites below. If you need more advice from our teams of specialist women's and men's health physiotherapists, then the relevant contact details for each of the teams are shown below. Thank you for listening.